Okay, good morning, everyone. Morning. My name is Trevor Noël, and I'm the Assistant Provost here at St. George's University for Research and Scholarly Activity. I bring you greetings from 12 degrees north of the equator and 61 degrees west, just to get your positioning straight. The Isle of Spice, pure Grenada. We welcome representatives of the Government of Grenada, Provost of St. George's University, Dr. Mark Clunes, SGU deans, other university officials, all the speakers, all the physicians and allied health science representatives, whether here present or online, to the International Cancer Conference for Geographically Isolated Populations. I will moderate the opening ceremony and introduce the first two speakers. I will now call on the conference chair, Dr. Aviane Auguste, to deliver remarks. Dr. Auguste, the floor is yours.
Right. So pleasant good morning to everyone in the room and online. It is a real pleasure to be here this morning with you. It's been a long road coming to this moment. We have worked very diligently and very hard to put this conference together. Before, I don't want to spend too long giving these open remarks because I want to give plenty of space for the science. I believe that this is a topic, cancer in geographically isolated population, that has been very much understudied. And so just to give you a background as to why we're here today. So I'm a professor of epidemiology at McGill University, and I think it's important to highlight that I came into the Department of Epi in McGill with the intention to fill a gap that was very important in the department, but also to fill a very important gap in science, which is understanding how do persons in remote locations or in underserved communities access cancer care. And I think the expertise that I bring to the table is something that has been a lot of persons, we know of it as persons from small islands, from rural communities. We understand that this is we're a lot of problems that are coming out of our everyday life as practitioners, as oncologists, as researchers, but we haven't really maybe deeply thought about how to solve these issues. And I think so the intention here today is to federate a group of researchers, practitioners, and policymakers to begin really creating a space to develop the science so that we can come up with actionable solutions in the near future. And I also want to take time to thank my employer. There are a lot of persons to thank, but I'll go quickly because if it wasn't for the open-mindedness of the Department of Epidemiology in recruiting me on this position, I would definitely wouldn't be here today. So I think there's a necessity to acknowledge that openness in wanting to uplift scholars, not just any scholars, but Black scholars from the Caribbean. And we're seeing the impact and how that's unfolding today. I want to also just take the time to acknowledge the generous support of all our partners, especially St. George's University, who generously give us this attributed this space for us to be able to have this conference and all the many resources that have given us. I'd like to highlight the Martinique Oncology Platform and the generous financial support in putting together this conference, as well as the Cell Tech Laboratory in Guadeloupe, which is specialized in head and neck cancer epidemiology and HPV epi. So this lab is positioned itself as the important organizer and a supporter of this conference. Also like to acknowledge the Vonnie Lewis Institute for Research and Innovation in St. Lucia, Sarah Felice Community College, and our many other partners who have been looking diligently and very consistently to put this together. And so, as also I'm the chair of the conference, but also chairing the scientific committee, when we first started this, we're not very sure what impact it would get, how much persons we would be interested in this. And to our surprise, even in a very short period of a short call for abstracts, we were able to get a surprisingly large amount of persons interested in this venture, which in the beginning was just a crazy idea in my mind. So we carefully curated a list of speakers that hopefully you will be able to learn a lot from them. We're covering geographic areas from Africa to the South Pacific, Europe, notably in the UK, the Caribbean, and so on and so forth. So just to show us how universal these problems are. So we may be in a small island in the Caribbean, but these problems are universal. And we have to work together, and this conference will hopefully do that. Right. So without further ado, I wish everyone here online and in person a wonderful conference, and I hope you enjoy the program we have put together for you. So I'll hand the mic back to our moderator.
Thank you very much, Dr. Auguste. At this juncture, I would like to invite the PAHO representative, Dr. Taraleen Malcolm, advisor on non-communicable diseases and mental health for PAHO, Barbados and the Eastern Caribbean, to deliver remarks.
Good morning, distinguished colleagues, partners, and friends. On behalf of the Pan American Health Organization, the World Health Organization, I'm very pleased to bring greetings this morning and to thank the organizers for inviting PAHO to be part of this conference. I also bring greetings on behalf of Dr. Amalia Del Rego, the PAHO WHO representative for Barbados and the Eastern Caribbean countries, who send much success for this conference. So across our islands, cancer care too often requires medical travels beyond our national borders, driven by limited specialized services, our very small population, and constrained health system resources. For many patients, this journey involves high out-of-pocket costs, administrative barriers, and journeys that include sometimes treatment interruptions and profound emotional and social strains. So medical travel, while life-saving for many, can also increase inequities. Those with fewer financial resources, limited support networks, or late diagnosis are most at risk for delayed care or foregone treatment altogether. For small island developing states like ours, achieving cancer equity means ensuring that island size or isolation does not determine survival. For PAHO WHO, we encourages regional, people-centered approach, one that strengthens early detection and referral at home, improve coordination and quality assurance for external care, and ensure continuity when patients return home. At the same time, we must continue collaboration, service sharing arrangement, tele-oncology, and a well-supported health workforce, reducing preventable dependence on overseas care over time. This conference is a great opportunity to align policies, practice, and partnership so that Caribbean cancer care becomes more accessible, more equitable, and more resilient. PAHO WHO remains committed to supporting member states in these collective endeavors. So I wish you a successful and impactful conference. Thank you very much.
Thank you very much, Dr. Malcolm. I would like to invite our Provost of St. George's University, Dr. Mark Clunes, to deliver remarks. Dr. Clunes, the floor is yours.
Thank you very much, Trevor. I just want to extend another warm welcome. I know we've had the policy workshop over the last few days, and to extend it into this is a wonderful opportunity for us to host not just the people here on island, which has been wonderful to meet you, to have that collegiate interaction, but also to our colleagues online. I'm going to keep my remarks very brief because I share the sentiment. You want to get into the meat of what we're going to talk about today, and I think our PAHO representative said it far more eloquently than I can. But I do want to just remind that one message that we talked about yesterday. We all value diversity in today's world, but when diversity becomes fragmentation, that is a different story. And the problems of access and barriers and equity all are too real in this region because of that mosaic of islands, the mosaic of governance systems. So I just want to thank you all, welcome you warmly to St. George's University. We're very proud to host these. I think when I moved to Grenada 20 years ago, one of the things I was most nervous about moving down to an island university was that we didn't become the Galapagos of the Caribbean. So I think always what I mean by that is that in isolation, you can mutate into something very different from the norm. And I think these type of contact points between multiple institutes, multiple universities, multiple government agencies are crucial to keep us all collaborating and working together. So I just want to say thank you very much for your time this morning, and it's a great, great pleasure to welcome you to St. George's University. Thank you.
Thank you very much, Provost Clunes. It is my honor and privilege to welcome our featured speaker, Dr. Stephen King. Dr. Stephen King is a pathologist. He is a fellow of the Royal College of Physicians of Canada and an international fellow of the College of Pathologists of the USA. He was educated at St. Mary's College between 1969 and 1974. He continued to the A-level college, which is now SALCC, and was awarded the Ireland Scholarship in 1976. He pursued a degree in medicine at the University of West Indies. He graduated in 1982 with honors in physiology, medicine, and therapeutics. He worked as a district medical officer in Soufrière from 1983 to 1985. He then pursued his postgraduate studies in pathology at the University of Toronto between 1985 and 1989. He returned to St. Lucia in 1989 as the consultant pathologist at Victoria Hospital, where he established the Ezra Long Laboratory, which he directed until 2004. He was the chief medical officer at the Ministry of Health from 2004 through to 2007. He founded Laboratory Services and Consultations Limited in 1993. Laboratory Services continues to expand the range of medical laboratory services to the general population and promotes laboratory technology and access to high-quality laboratory information. He was one of the co-founders of the Tapion Hospital. He was chairman of the Health Sector's Reform Committee and one of the architects of the St. Lucia Health Sector Reform Proposals 2000, the Universal Healthcare Proposal of 2003, and the National Strategic Plan for Health in 2006. He was one of the co-founders and the first chairman of the AIDS Action Foundation and one of the co-founders of Rise St. Lucia Incorporated. He has advocated for healthy human development, youth empowerment, and reduction in violence. He promotes and actively uses the Cure Violence approach to reducing violence. He was an appointed independent senator in St. Lucia for the period 2011 to 2016. He was awarded the Most Excellent Order of the British Empire, the OBE, in 2008 for his contribution to medicine, and the St. Lucia Cross in 2018 for his contribution to society. The title of his keynote address is Improving the Caribbean Small Island Developing State Access to Cancer Prevention and Control, Implications for Care Seeking. Dr. King, without further ado, the floor is yours, albeit virtually. Please put your hands together to welcome Dr. King.